Hello, everyone. Welcome to the ACHS webinar series. My name is Paul Lim. I'm the lead for biorisk management at the ACHS Center for Health Security, which is an academic think tank based at the National University of Singapore, Soswi Hawk School of Public Health. And I'll be your moderator for today's session. So with that, we're just going to go ahead. I'm an adult ID physician working at the National Center for Infectious Diseases in Singapore. And I also work at the Communicable Disease Agency here. And I have an interest in outbreaks, vaccines, as well as global health security. So I first got to know Paul when I was chair for the WHO Health Security Interface Technical Advisory Group. I chaired that starting in 2019. We have been launching this webinar series as well as a number of other events at ACHS. So this is the third in the webinar series. We have the privilege of having distinguished speakers from all over the world addressing us on topics of biosecurity, interest in Asia, things that affect Asia. So I'd like to introduce today's speaker, who's Paul Arbon. He's the Matthew Flinders Distinguished Professor and Director of the Torrens Resilience Initiative at Flinders University in Adelaide, Australia. And we first met when he hosted a biosecurity event there for WHO. It's a WHO coordinating center. And he's a past president for the World Association for Disaster and Emergency Medicine, as well as he's the former chief commissioner for St. John's Ambulance in Australia. He has had extensive experience with mass gatherings, as well as health emergency response for disaster events. And he focuses on security, resilience, mass gatherings, strategic risk, and information. So during our work at the Health Security Interface Technical Advisory Group, Paul led a work group on how to do risk assessment for deliberate biothreat events. And that framework is now being used by the World Health Organization as we sort of sort through the many different outbreaks and ambiguous events with a changing sort of increasing geopolitical turbulence. This has become an area of increasing concern. So with that, I'd like to just welcome Paul. He will be speaking to us on risk assessment for deliberate biothreat events. Thanks, Paul. All yours.
Thank you, Pauline, for that introduction. I'm going to spend the first part of this evening working for about 30 minutes through these slides. And the slide set has a good deal of content, but I wanted to make the point up front that we've agreed for the slides to be distributed if you would like to have them. That's important because there's a fair amount of material, and if you want to go back and look at it, follow up on some of the points that I skim over, then you can do that at a later stage. The focus this evening for us is in large part on risk assessment in complex systems for deliberate biothreat events. And I want to talk a little bit in the front end about why complex systems are problematic and difficult for us. We'll then talk about how you prepare in the context of that kind of risk, but also how to respond and how to build a more resilient system so that in the context of the changes in the global situation that Pauline has just talked about, and in the context of these interconnected, interdependent, somewhat emergency events, we can survive better through the event. So if I can have the next slide, please, we'll start to talk about some of those issues. And just quickly, this is a little bit of sort of emergency management basics, and my apologies for those of you that have seen these things before. The first point to make, however, is that the health emergencies that we see in the modern world demonstrate a different characteristic, arguably. In the past, they may have been relatively localised, relatively easier to respond to because they're in your jurisdiction only, and involve the resources that you have available to you, and in many ways don't affect other aspects of social life and community life. And of course, now many of the health emergencies that we see are much more widespread, sometimes have global impact, as we saw with the COVID pandemic, but also damage systems that we didn't expect would be damaged, other sectors of society, and involve other departments, other ministries, other outcomes that arguably are not necessarily directly related to the health response, but challenge our ability to do a health response. So this complex system in which we're operating and the complex effects of health emergencies is increasingly challenging for us. We go to the next slide. So this diagram describes some of those societal sectors that we tend to think about. So in the emergency management, the risk assessment world, we would think about these sectors as being the key ones when we're thinking about preparedness for an emergency event, public health emergency or any other kind of emergency. And you can see the list, you can read around the circle, so public health and medical care, of course, but also logistics and transport, public safety and security, functioning government, education systems, power, water, energy supply, economics, all of those kinds of things. And whichever sector you might work in, you very quickly discover that you need other parts of the system in order for you to do your work. So in the public health or medical system, we are clearly very reliant on continued logistical support, on communication systems to be able to do what we need to do to respond, on politics and government to support us, and so on and so on. So these things are interconnected. And an event that is a health event will affect others in terms of their ability to sustain those services. And an event that is some other kind of emergency may well affect us. So it's this complex system, or if you like, systems of systems that affect the work that we do. And we see this happen in biothreat events. The two examples that I want to show you that illustrate how this actually works are related to COVID-19, to the pandemic, and some of the work that we've done in the pandemic space. So if I can go to the next slide. This picture describes the findings of some work that we did in Australia for the Department of Defence, looking at the cross-jurisdictional, given Australia is a federation of states and territories and a national government, but across the system, what sectors were most significantly impacted by the pandemic. And you can see the obvious ones, I guess they're obvious, at least in our context, are public health. And in Australia, the economy, the economic impact of shutdowns, of quarantining communities, of closing businesses and schools, all those kinds of things had a very significant effect on the economy. And also in part because we tried to provide better support for individuals in the community through government funding. So big financial impact. And public health, of course, was, I'll say, overwhelmed by the pandemic and responding to it. But the orange pieces in the diagram are the pieces that are most interesting because that's the cascading impact of these events. And you see that the medical services clearly had significant impacts, but so did food and grocery in Australia because of the panic buying of various goods. Logistics and transport in terms of being able to cross state borders when states were quarantining people from moving. The communications and media space in the context of misinformation and rumour and getting good health information out into communities. Education, interestingly, because we closed schools, and therefore that had a flow-on effect to other sectors because parents had to stay at home to look after children, particularly in healthcare, that's an issue. And functioning government and politics, which is stressed by these kinds of emergencies, as you would expect. So you see a cascading flow of impact across all sorts of sectors from what is essentially a health emergency. And in the case of the pandemic, perhaps an emergency that once we would have thought we could deal with on our own. So if I can go to the next slide, please. And then we did some work, won't spend much time on this, but some work looking at what government officials across the jurisdictions, across the 9 governments in Australia, felt were the most significant challenges in doing their job during the pandemic. And you can see that the most important ones were dealing with information, getting good information out, and combating the infodemic that accompanied the pandemic. We saw that resources were scarce. We saw that consistency in messaging, in policy, in regulation, in law were really problematic, and some of the others, communication, trust, those sorts of things. So a whole of government impact of these events. Now, the reason I want to tell you about those things is that sometimes in health, we take the view that these health emergencies are health emergencies and that health should and is able to conduct the preparation and response to these emergencies in isolation. And clearly that's not true. These are events that impact on the whole of government, and central governments will take charge and try to coordinate what we all do to combat these bigger events. If I can go to the next slide, please. There are just 2 or 3 principles that I'll put on the screen, and I want you to think quickly about. Maybe go back after this presentation and look up and think about. One of those is the idea of black swans. I raised the issue of black swans because a black swan in this risk and emergency space is defined as an event that is unplanned for, unexpected, and catastrophic. So it's an event that doesn't appear in our normal threat assessments and in our normal risk management. It's just not thought about, it's unthinkable. So black swans are really challenging events, and the deliberate biothreat events often sit in that space. Not the thing we thought was likely to happen in our community, not the thing we thought would happen this year in our community, and suddenly it's upon us. The other concept is the idea of Thanksgiving turkeys, which is an American kind of a concept, because in America, at the Thanksgiving holidays in the US, people sit down for holiday meals, eat turkey as part of the main meal. It's a big celebration. Thanksgiving turkeys are important in the United States, right? But it's an exemplar of the problem of modern risk assessments. Because in modern risk assessments, we look at, over time, the likelihood that there will be a problem from a particular hazard and the consequences of that hazard should it turn into an event, right? So what is the hazard? What is the risk? What is the consequence? But that works most days. In some contexts, it doesn't work. And the Thanksgiving turkey is an example of why normal risk management sometimes doesn't work. And the story goes something really simply like, if you're a turkey in the United States, every day you will be visited by a human who brings you food, checks that your cage or your shelter is secure and safe, gives you water, and leaves you, comes back next day, does the same thing, gives you more food, more water, checks your surrounds, makes sure that you're safe. And every day that occurs, the likelihood that humans are potentially dangerous reduces, the risk assessment reduces, to a point after 364 days that you might consider humans to be not dangerous, not hazardous, no risk, right? And then on the 365th day, the human brings an axe and chops off your head, right? So your risk assessment has been of no use to you. And that's the problem of the way in which we do risk assessment for these kinds of events. So in the deliberate biothreat event space, what I'm going to try to do is to argue that the best things we can do is to strengthen our systems so that we're prepared to respond to any kind of event, even the ones we didn't expect. And the question is, how do we do that? How do we make a system that is more resilient to the kind of challenges, the perturbations that can occur, either because we thought they were a threat or because we just didn't know? Next slide, please. And then this is not a new idea, this idea that we just don't know things. Various philosophical writings have talked about the difference between known knowns, the things we know are potentially hazardous or threats, between known unknowns, the things that we know we don't know, and unknown unknowns, which are those things that we just haven't thought about. And we need to be prepared for each of those kinds of health emergencies. And Here Be Dragons relates to that story. It goes way back to the time when explorers in all countries, in mapping the environment around them, setting sail, looking for new land and mapping the environment, would draw on the maps that they constructed a sea monster or a dragon to indicate those places where they just didn't know what was there. Right? Vacant space, don't know. So Here Be Dragons is that idea that there are things that we just can't prepare for because we just don't know. Next slide, please. So if we get into deliberate biothreat events more specifically, what I want to do is to talk about what we think they are, to talk a bit about why they might be unique, and then to talk a little bit about the organisms and the way in which they might present, so that we've got that kind of coverage. This definition comes from the fact sheet that the WHO produced describing what a deliberate biothreat event might be. And it talks about a malicious act, intentional release of a biological agent or toxin, maybe announced, maybe covert, or maybe ambiguous. We just don't know if this one is a natural outbreak or a deliberate one. So it can be ambiguous as well. We don't know if it's deliberate. The public health consequences of these events can vary in the way that most emergencies do, in scale, scope, intensity, and duration, and in focus, what is the target of this particular deliberate event. And they vary widely, so it's difficult to describe a generalised deliberate biological event. They can have major impacts, they can have very minor impacts, they can be focused on a particular restaurant or supermarket, or they can involve whole communities. These kinds of scenarios are often talked about as existential disasters. That's because they threaten existence, if you like, or complex disasters because they involve all sorts of consequences that we need to deal with. If we go to the next slide, thank you. We then talk about, well, what's unique about these events? And that's a very difficult question. It's central, though, to thinking about how you might prepare. So if we understand why the event is different from a natural outbreak, we might be able to prepare better for deliberate events. Some of the unique characteristics include potentially widespread outbreak, depending on the agent used, but certainly potentially outbreaks in a number of different locations and sometimes across borders in one airport or another airport and so on. So it might be a international event as well. Sometimes very difficult to distinguish from a normal event, particularly if a normal agent is being used. The response might well differ from your normal emergency health response, because if people believe that it's ambiguous or deliberate, all sorts of other agencies will become involved. We'll talk more about that as we go along. We need to think about what the indicators are, what the signals are that help us determine that an event is deliberate. And when a deliberate event is suspected, we need to think about the twin response efforts, often run in parallel, but often trip over each other. So those two efforts are the public health response to protect people and to treat people and do surveillance and so on, and the security and policing response, which is focused instead on forensics, on investigation, on chain of evidence, and on tracking down and stopping perpetrators who may still be active. So those twin lines will be running at the same time in some of these events and obviously compete with one another in some ways. So the nature of the event, the other unique characteristic, the nature of the event may not be clear for some time, which means that we roll out our normal natural outbreak response to these kinds of events, and it may not be until later that we discover that we need to be worried about further events occurring over time as a malicious actor continues to conduct deliberate biothreat releases. And finally, the cross-sectoral cooperation, which is not only about within your government, because it will be, between agencies like Attorney Generals, legal, education, public safety and emergency services, security agencies, national security agencies, and so on, will all want to play in this space, but also between countries, which makes the context of this a little more difficult again. If we go to the next slide, please. So there are two slides here about the differences between deliberate events and natural events. And you might add to this list. These are some of our ideas about what's different. And again, these are the slides you might want to read through carefully after the presentation so that we, as I skim through them. The first of those is international involvement, which I've mentioned already. If it involves more than one country or a number of countries, it may lead to, and even if it's one country actually, sometimes, it may lead to United Nations involvement. It may lead to the UN Secretary General's mechanism for the investigation of alleged CBRN or use of chemical and biological weapons. So there's that implication as well. It will in any case be multi-agency because the national response will involve non-health agencies and is likely to be led by non-health agencies if it's considered deliberate. And that would involve potentially a different chain of command and a different emergency management plan than the one that you've developed internally. So we need to think about how those two things are brought together and work together. The multi-agency response is going to be cross-sectoral because, as I've shown you in the previous slides, a whole lot of things start to depend on one another. So if schools are closed, that has implications for how many nurses come to work, for example, right? There are these crossover implications, cascading consequences, often surprising consequences of this kind of management of a health emergency. So trust is really important. Building relationships before an event occurs is really important. And notably, as I said before, the police and forensic investigation is going to do some things that make your work potentially more difficult. The scene of the deliberate release is likely to be treated as a crime scene. It may be secured. You may not have access in the way that you would like to. Samples may go to different laboratories. And the chain of evidence in terms of securing the sample and ensuring that a particular sample is tracked through to laboratory findings and becomes evidence in the legal investigation can also get in the way of doing the kind of work that you need to do as well. So talking about how this might work before it actually happens with these agencies is, again, particularly important. Next slide, please. So the other differences in this context are that media and public awareness, which is in any case heightened during a natural outbreak, will be exacerbated. It will be heightened even further, in part because of the fear that the public might have that the perpetrator is still on the loose and there is still a perceived danger that there will be further attacks, but also because the agent might be different and people are receiving misinformation and rumour about what is actually happening. Political involvement in any case a problem, potentially, but heightened during a deliberate event for all of the reasons that you would expect. It's not surprising, is important that politicians and government take an interest, but nonetheless it will be heightened. And then consequences in terms of national stockpiles, which will start to be used in this event. Go to the next slide, please. There are differences also in the detection, response, and diagnosis. The agent may behave differently. It may have a different clinical course than the agent that you normally expect. So the same organism, having been altered in some way, may have a different clinical course than you expect it to have. So the presenting illness might be rare, might not be naturally found in your community, may have been imported from somewhere else. Diagnosis and recognition and treatment may be delayed because clinicians are not used to that disease, haven't seen it before, not sure what it is. National laboratories may not have the facilities. Pathogen may have been changed, I mentioned that. And for high consequence pathogens, of course, specific facilities and equipment might be required. And there are differences in the presentation, transfer, and therefore mapping of the disease as it spreads that might be important as well, particularly because the organism may not be in its usual environment too. Next slide, please. And then just the second one of these. So the mode of infection and transmission may not be predictable, may be different, may progress at a greater speed because it's been engineered in some way. There may be very large numbers of people exposed. Normal health sector surveillance may not pick up a deliberate outbreak early enough, although often social media will. Other forms of information may provide you those clues that you need. It may arise in multiple locations simultaneously or progressively over time, but there may appear to be a number of outbreaks occurring, as I've said before. Repeated deliberate releases in different locations expose different populations, so that profile may change. That's actually challenging in terms of how much of your medical stockpile you use, in which location and at what time, and how you sustain supply of medical stockpile. Over time, there are all sorts of ethical and triage-related questions in that space. And then the last one of those, health authorities will need to be prepared to respond to unexpected and continuing instances of exposure. So a range of differences. Again, you might think of other ones. So this is my first cut at a list. Next slide, please. So the best thing to do in this situation, of course, is to prepare for such an event before it occurs. Right now, to start to think about how to prepare. And there are several things I'd argue for. One of those is intersectoral collaboration, really important. You do that a bit through scenario-based exercises, but also through the development of joint emergency plans. Those things get people to talk to each other, they build trust, but also build systems and procedures that you can use. You need to account for mass casualty incidents and ensure that those plans are up to date, but also in this space that they actually relate to an illness scenario as distinct from a trauma scenario, because most mass casualty plans are built by people focused on trauma. if that's a fair comment. In many countries, that's true. Require a realistic assessment of health system surge capacity. That means thinking about capacity and capability that you have in your system, including the ability to just in time train staff so that they can assume roles that they don't normally do. So what is your just in time training system look like? Being prepared for the, I think, inevitable large numbers of worried well who present at health facilities, often in communities a long way from where the event is occurring. So this response of the public looking for help because they think they might have the problem is important to manage as well. That includes planning for the security of health system venues, because you need a secure boundary in order to do triage, to do decontamination, those things that you want to do. You need to ensure that you have a security arrangement that ensures that people are not just turning up in the ED department at the desk without having been through some kind of triage. Rumour and disinformation. We've done a whole lot of work on mis and disinformation in these contexts. It's one of the most challenging and important issues in health emergencies today. Lots we can talk about in that space. And the psychological effects of deliberate events also need to be thought about in terms of how we reassure the community, what information we provide, how we ensure that we have the precursors of good health information, which are trust and consistent messaging about the science. Next slide, please. And then getting towards the end, planning is an essential requirement across government. Just remember that plans only survive until about the first or second day of your response, because you discover that you need to be adaptable, responsive, you need to change the way you're going to do something because of unexpected consequences. So plans are to get you started. And one of the best things you can do in exercising actually is exercising moving from slow time, business as usual, to fast time. So it's that 2 days, day or so that it takes from being aware you need to do something to actually doing it, is this period where the plan is really useful. So think about some of those kinds of things. I think one of the most important ones is clear lines of command and communication, because they change. And in the planning, one of the most important things is to ensure that you've identified who the lead combatant agency, the so-called lead agency, is in the plan. So that if it is going to be the police or a security agency or the President or Prime Minister's office, then that needs to be in the plan, so that health understands who it is responding to, so that health can command its response and be organised and work with leadership in an organised way. So if that planning is set up in the front end, it also helps to moderate the political interference that can occur during these events, because you have a plan that's agreed and a command structure that's agreed before the event occurs. So all those things are important. And then just the last slide, I think, next. Yeah. And so then the big question, the $64 million question is, well, what do we do about this? I've talked a lot about how problematic these situations are and how complicated they can be. But what can we do now to help us prepare for these events? And the quick and short answer is to build the resilience of the systems that you depend upon every day. So think about what it is that your public health system and your medical system requires to do the work that it needs to do, regardless of any kind of event. And those things include some kind of capacity, sometimes some kind of cache storage. It includes communication systems that won't fall over. It includes the ability of staff to get to work. It includes training and education that's suitable, including just in time. All of those kinds of things that I know you can all think about that will build the resilience of your system, whether or not it's a major trauma event infrastructure collapse or something, or it's a deliberate public health event. So some of those things you can do every day, and they build the capacity and capability of your system to take a hit and to survive better through that situation. But in saying that, what I'm trying to say in this slide is that we usually, when we do that kind of work, think about the systems. We think about ensuring that we have supply, ensuring that we have access to water and electricity, whatever it is we're trying to do to keep our laboratory or our hospital functioning. And you do need to do that. That's very important to do. However, the other thing that we need to think about in terms of the resilience of the health system is the resilience of effects. So resilience of systems and resilience of effects. And effects are not things, effects are attitudes. So we need to think about today building the resilience of the things we depend upon to get the community to help us to respond effectively. So that includes trust, it includes good health education, it includes information that's pre-prepared to provide to people. All of those things are important. It includes partnerships with other agencies across government that are already built. It includes understanding vulnerability and value because they're different things. So just because the thing is vulnerable doesn't mean that it's valuable. So you might not protect it, even though it's vulnerable. But if it's valuable, you do protect it. We think about reputation. How do you protect the reputation of your laboratory or hospital? Because if you lose reputation, you can't have any good effect, regardless of how good you are, because people won't come to you or they won't trust you. So there are some of those things that I think are effects that are as important as the system pieces that you also want to build resilience for, right? So that has been a very quick kind of tour through risk assessment and deliberate biothreat events. I'm hoping that some of those words or ideas have generated questions that you want to ask, and I'm happy to talk about them as much as I can. But then, of course, you might need to look at some of these terms and go into the literature and just follow up some of these things if I've skimmed across it and you're interested in finding out more about those things. So thank you, Paul Arbon and team.